Our presentation is on youth suicide prevention. Suicide is a major public health concern reported as one of the leading causes of death among youth aged 15 to 24 in Canada, the US, and around the world. To reduce the high suicide rates, it is necessary for evidence-based prevention strategies aimed at young populations to be implemented within our society. The focus of our research was suicide prevention techniques for youth, including factors that increase the risk of suicide, determining what current methods exist, as well as determining gaps in prevention methods that need to be addressed.
The most significant risk factor among youth is shown to be psychiatric disorders, as young populations with mental disorders are 10 times more likely to attempt suicide. Furthermore, over 90% of youth who die by suicide have at least one mental health disorder. The most common diagnoses that result in suicide are affective disorders, substance use disorders, eating disorders, personality disorders, and schizophrenia. Our research suggested that the association between suicide and mental disorders can be largely explained by symptoms and experiences that individuals with mental illnesses often encounter. These include distress, impairment, hallucinations, depressive distortions of perceptions, stigmatization, and feelings of hopelessness. Finally, our findings demonstrated that the need for early detection of mental disorders among youth is a significant aid in reducing youth suicide rates.
In our research, we found that alcohol and substance abuse among youth is associated with increased suicidal behaviors and suicidal deaths, as well as being one of the most common psychiatric disorders relevant to youth suicide. This means that youth who have a concurrent disorder are at a significantly greater risk of suicide attempts and reattempts. The human brain is still developing well into a person's early 20s, and most mental illnesses develop while the brain is still not fully developed. This period is also when the brain is most vulnerable to damage from drug and alcohol abuse, which is why youth are at a greater risk of having a concurrent disorder. Many addiction specialists also believe teens with mental illnesses turn to drugs and alcohol to self medicate. Thus, recognizing early signs and symptoms of substance use among youth is just as necessary as recognizing stages of depression and mood disorders in terms of preventing suicide.
In our research, we found that there were many differences in rates of suicide and ideation among genders, and that the prevention methods differ as well. For adolescent males, they are less likely to engage in professional help seeking compared to females. Our research expressed the importance of promoting early awareness and accessible services for males as an effective prevention method. For adolescent females, there is a higher rate of suicidal ideation and attempts. Our research indicates that an effective prevention method is encouraging females to adopt healthy coping mechanisms. Overall, research has demonstrated that we must recognize the differences between both males and females regarding suicide and suicide prevention. When working with youth, recognizing these differences allows for the most effective prevention and treatment methods.
There were three subcategories of interventions being analyzed throughout our articles: school-based, community-based, and interventions using the healthcare system. Of the three, it was shown that more funding needs to go towards school-based interventions and healthcare interventions. Via school-based and healthcare-based interventions, early detection, as well as proper treatment and management of mental disorders, is associated with decreased suicide attempts and deaths by suicide among youth. Furthermore, our findings illustrate that effective suicide prevention strategies must be comprehensive, multifaceted, and operate at many different levels. Some of these identified strategies include screening activities, gatekeeper training, anti-stigma campaigns, crisis intervention, education and awareness for caregivers and the general public, controlling access to means of suicide, as well as increased social support to individuals living with mental health issues. Overall, research demonstrates that awareness initiatives and distributing information directly to the population who are in need is seen as effective, leading us to design an educational pamphlet for youth, their parents, and their healthcare providers. We found throughout our research that the current suicide prevention strategies for youth are lacking and require alterations to meet the needs of this population. Early detection of suicidal thoughts and behaviors amongst youth is key in terms of prevention strategies. When working with young populations, we also face a barrier regarding their awareness of how and where to access proper help. Our findings illustrate that young populations often do not access mental health treatment before attempting suicide, and that numerous individuals have gone to emergency departments in the same year that they died by suicide. Therefore, increasing the mental health literacy of youth and ensuring that individuals have awareness and access to the necessary supports is a vital element to reduce rates of suicide. It is important to recognize that youth may reach out for help from a variety of different supports, such as parents, guardians, healthcare professionals, or peers. Thus, all groups should be made aware of what to look for and the best way to help those in need.
Our research demonstrated a common theme that early detection of mental health disorders and suicidal ideation in youth is crucial when striving to lower prevalence rates. From our research, we also found that there is an urgent need for awareness surrounding the connection between mental disorders, especially mood disorders, substance use, and suicidal behavior among youth and parents. Our health promotion application is an educational pamphlet that will reside in general practitioners' offices and school offices, as well as be accessible online for both students and parents through a PDF version on school websites. By designing a pamphlet full of valuable information, our goal is to educate and increase awareness that will help to reduce suicide rates in the youth population. In addition, by providing many resources offered in Hamilton and Ontario, we are meeting the needs of youth who often face a barrier of not knowing how and where to access help. More specifically, the outcomes we hope to achieve are aimed at parents and guardians and youth, but this pamphlet can help to increase the knowledge of anyone who reads it. For parents and guardians, this pamphlet will teach them symptoms of mental health issues and substance use issues, as well as signs of suicidal behavior. It will also describe how to approach conversations about mental health, substance use, and suicide with their children. For youth, this pamphlet will assist in their connection to support lines and services to access help when experiencing suicidal ideations or crises. Youth may feel uncomfortable turning to their parents or healthcare providers in times of distress and instead reach out to their peers for support. Thus, this pamphlet is beneficial not only for youth experiencing thoughts of suicide, but also for them to recognize the signs in their peers and have knowledge if their friends reach out to them for help. Ultimately, our pamphlet will aid in the early detection of mental disorders, substance use disorders, and suicidal thoughts within youth with the objective of lowering reported rates of suicides. Here we are showing an overview of the pamphlet we have created. As a learning exercise, we will go into more depth explaining each section and why we have chosen to include it. The cover of our pamphlet is titled Suicide Prevention for Youth, and we included the Canada Suicide Prevention Service for people if they are thinking about suicide or if they are worried about a friend or loved one.
In the introductory paragraph, we wish to share the importance of the pamphlet. We shared that half of all mental conditions start by age 14, but are often undetected and untreated. When left untreated, these mental conditions can go on to influence individuals' mental well-being long-term. Through early intervention and detection, the trajectory of well-being in later life can be altered and suicide rates lowered.
Resources and helplines were included in our pamphlet to help connect youth to resources within the Hamilton community where they live. It was also decided to provide phone numbers to helplines in the event that a youth does not feel comfortable physically visiting an agency or it is past their hours of operations. This ensures that youth who receive our pamphlet are connected to resources that are available 24 hours a day. Helplines that were included are the Kids Help Phone, LGBTQ Youth Line, Hope for Wellness, which supports Indigenous individuals, the Crisis Outreach and Support Team, and Distress and Crisis Ontario. Resources within the Hamilton community include the Youth Community Mental Health Program, the Barrett Center for Mental Health Crisis Support, and St. Joseph's Youth Wellness Center.
In our pamphlet, we decided to include the signs of suicide. We decided to include this so that individuals know what to look for if their child, loved one, or a friend is contemplating suicide or thinking about suicide. The risk factors are mental illnesses, misuse of alcohol and other substances, trauma such as violence, bullying, child abuse, or neglect, significant loss, either of a relationship, job, or cultural loss, major life changes or stressors, which include homelessness, poor physical health, death of a loved one, or harassment, lack of access to mental health services, and lack of support. Warning signs are talking, thinking, or writing about suicide, talking and feeling worthless or hopeless, talking about being a burden to others, losing interest or withdrawing from activities and hobbies, taking dangerous risks such as driving too fast, feeling extremely sad, more anxious, agitated, or full of rage, any changes from typical behavior. If a friend, child, or loved one tells you they are having thoughts of suicide, the way to approach this conversation is to be honest and express concern, listen and offer support, take them seriously, offer to accompany them to seek help.
Included in our pamphlet are signs to look out for regarding worsening or developing mental health and substance use issues among youth. Behaviors to look out for in youth regarding mental health include low motivation, negative self-talk, withdrawing from friends and family, and a pessimistic worldview. Signs for developing substance use among youth include irritability surrounding the substance use topic, withdrawing from friends and family, brushing off concerns, and giving responses such as, "It's fine, don't worry about it," when asked about their substance use. We included this section to give some insight on some of the more subtle signs of mental health and substance use issues in youth for parents, teachers, and mental health care professionals. Our research focused heavily on the need for early detection when considering ways to decrease youth suicide rates. This is a very important aspect in trying to increase early detection for these issues in youth because signs are not always blatantly obvious. If we're able to catch these subtle signs before they develop into worsening issues, it may greatly aid in youth suicide reduction.
We wish to share some tips for talking with youth about mental health and substance issues. These tips are primarily for guardians of the adolescents, but could also be used by friends, teachers, and healthcare professionals. Primarily, it is important to make mental health an ongoing topic of conversation and have open and honest lines of communication with youth. If an adolescent brings up mental health concerns, it is important to take their worries seriously, listen in a non-judgmental manner, and keep an open dialogue about what their needs are. They could be looking for a listening ear or may want help in accessing resources. When talking about substance use, many of the same principles remain, such as open and honest lines of communication. However, in addition, it is important that guardians make their position on substance use known. This being said, it is also important to hear the youth out and why they are using substances. This may help the individual to connect with the youth and help them to understand the situation better. Finally, when discussing substance use, it is best to maintain an air of curiosity and interest as opposed to accusation and fear. The emphasis should be placed on the fact that we are all humans and make mistakes. Overall, our research indicated that one of the best ways to reduce youth suicide risks given the most prominent risk factors was early intervention. Thus, we created our pamphlet to promote increasing early detection for youth by educating and being available to parents, teachers, healthcare providers, and any individual concerned about the well-being of youths.